Hello, today's topic will be on schizophrenia. The purpose and objective of this presentation would essentially be to provide a comprehensive overview of schizophrenia's prevalence in today's society and its risks, while also making sure to delve into the treatment and prevention strategies. The presentation will ultimately aim to offer valuable information for one of the most serious and misunderstood mental health disorders in the country and emphasizing the need for more public health initiatives aimed towards raising awareness regarding schizophrenia. Here are the table of contents for the presentation. To start, we'll review the definition of schizophrenia, what it is. Schizophrenia is essentially a chronic brain disorder that affects the way a person thinks, feels, and behaves. Unlike other mental health conditions, the concept of schizophrenia emerged more recently in medical history, but this will be delved more into in an upcoming slide where we will review the origin of schizophrenia. For now, we are simply introducing the general background of the mental illness, and to start off, it would be important to know that schizophrenia is actually viewed as a spectrum of related disorders due to the similar features and symptoms it shares as other illnesses. The Venn diagram right here goes to show the overlapping symptoms and signs that schizophrenia, major depression, and bipolar disorder all share amongst each other. Here on this slide, we're delving more specifically into the symptoms of schizophrenia. For schizophrenia, due to its complex and complicated nature, the signs and symptoms vary from person to person, but they generally fall into three categories as you can see right here: positive, negative, and cognitive. Table 1 here shows the symptoms for each category and its relative severity, frequency, and patience, as well as impact on overall functioning. Positive symptoms include quote-unquote additions to normal behavior, such as hallucinations, delusions, and improper speech. Hallucinations may involve hearing voices, while delusions would be more so having strongly held false beliefs like paranoia. Negative symptoms include flat affect, which simply means reduced emotional expression, avolition, which means lack of overall motivation, and anhedonia, which means reduced ability to feel pleasure. These negative symptoms, as mentioned earlier, can resemble and overlap with the symptoms of depression as well. Lastly, cognitive symptoms include memory issues, disorganized thinking, and inability to process social cues, causing overall limitation in social skills and information processing. Now, if you examine the table, the severity, frequency, and patience and impact on functioning for both negative and cognitive symptoms are fairly similar, as they show to be mild to moderate in terms of severity, common in frequency, and moderate in terms of impact on functioning. However, for positive symptoms, you'll see that the severity can range from moderate to severe and can be common to very common in patients, as well as having a high impact on functioning. Now in this next slide, we will be going over, as we mentioned earlier, the origin and cause of schizophrenia. To start, we will be taking a look at this very simple yet broad timeline showing the development of the term schizophrenia. Starting from the mid-19th century, the term démence précoce was introduced in France to describe disorders with unknown causes that primarily were seen to affect young people and led to a gradual decline in their mental and social abilities. Around the same time in Scotland, these cases were referred to as adolescent insanity, and in Germany, a psychiatrist studied and identified a catatonic syndrome, while his student described another condition called hebephrenia. It wasn't until the late 19th century that these ideas came together under the term dementia précoce, introduced by Emile Kraepelin. Kraepelin observed patterns of early onset and progressive social and cognitive decline in his clinical cases. But it wasn't until a Swiss psychiatrist, Eugen Bleuler, replaced the term with schizophrenia, as you can see from the yellow font, where it was more emphasized. The idea, fragmented thoughts, emotions, and actions were more emphasized in his terms. Bleuler viewed schizophrenia as a combination of related conditions rather than one single disease. Thus, Because its symptoms overlap with other mental health disorders, as we mentioned earlier, schizophrenia is now often seen as a spectrum of related disorders with shared features. Ongoing research is continuing to help us better understand schizophrenia and create treatment plans tailored to each individual need, while also supporting the idea of schizophrenia being a quote-unquote spectrum of related disorders influenced by physical, environmental, genetic, and psychological factors. Now, the cause of schizophrenia is unknown. However, if we look at this next slide here, this diagram shows all the potential causes or factors that could play into influencing or triggering schizophrenia. This image essentially outlines a framework for understanding the causes of schizophrenia and psychosis. It highlights the interplay of genetic factors, maternal/fetal infections, and environmental stressors like parental distress. These factors lead to a neurodevelopmental abnormalities such as ventricular enlargement, white matter injury, and reduced gray matter volume. For instance, in the third trimester of pregnancy, the fetus's brain goes through very rapid development, including synaptic formation, dendritic differentiation, and cortical layering. If this process is at all disrupted during this rapid development stage, perhaps due to poor nutrition or preterm birth, it can affect the brain development, thus increasing the risk of schizophrenia later on. Now, delving into the gray matter and white matter, gray matter helps with decision making and emotional stability, while white matter connects brain regions for communication. Both play key roles. Disruptions here can lead to problems with thinking, emotions, and coordination. Thus, it can be seen from this diagram alone how factors such as genetics, infections during pregnancy, and environmental stressors contribute to neurodevelopmental issues, which can impair brain connectivity and lead to cognitive deficits, social difficulties, and psychosis later on down the line. Now, moving on, when it comes to the treatment and prevention process, recognizing the symptoms of schizophrenia as early as possible is crucial in order to start treatment right away after the first psychotic episode. Most diagnoses occur between ages 16 and 30, and while there's no cure, treatment can reduce symptoms and prevent recurrence. As you can see from the figure provided on the left, the prevalence is highest in individuals aged 26 to 44, being at 1.5%, followed by those aged 18 to 25 at 1.3%. This further goes to emphasize the importance of early detection and treatment, essentially since schizophrenia often begins in young adulthood or early adulthood. Diagnosis of schizophrenia relies on tools like DSM-5, which requires 2 positive symptoms, for instance hallucinations or delusions, to be present for 6 months, and another diagnostic manual, ICD-11, which focuses on symptoms lasting at least for 1 month. These guidelines ensure early and accurate identification. Treatment methods also include antipsychotic medications to manage psychotic symptoms, with clozapine reserved for severe cases due to its severe side effects. Additionally, psychosocial therapies like therapy and skills training also help individuals manage daily life. Other than these treatment options, raising awareness and reducing stigma are also vital in supporting patients and encouraging treatment. Finally, here are some summarized details and key takeaways from this presentation. All in all, schizophrenia is a multifaceted mental health disorder that is known to be a quote-unquote spectrum of related disorders. If left untreated, schizophrenia can develop into a severe disability. Thus, it is crucial for timely diagnosis and treatment to reduce chances of severe implications to occur in the future, as well as reoccurrence. It is also essential to create a supportive environment for those affected, whether it is through mental health awareness, reducing stigma, or through family support. This is crucial due to helping recovery. And to wrap this presentation up, here are 5 questions with their answers given in the following slides. All the answers are reviewed and from the presentation slides that were explained before. And here are the references.